It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Dr. Annie Varghese and welcome back with another edition of Best Docs Network, featuring some of the best physicians in the Houston area that have helped change people's lives. We have a fabulous show for you today again, and let's learn more about our first doctor, Dr. C.T. Nguyen. He's an ENT surgeon helping people to breathe better. So many of our people in Houston especially have allergies, have sinus problems. Let's see how he has helped many patients in his practice.
Originally, I was having a lot of sinus pressure. Pretty much all the time I had sinus pressure. And I had a lot of headaches. I would have sinus infections pretty much back to back. I'd have several sinus infections a year. Amanda
has consulted multiple ready clinic urgent care that does not really address her problem. All they did was to refill her prescription of antibiotics, gave her some antihistamine, and tell her to go home. But what they do is they treat her symptoms instead of treating the cause of her problem.
He basically just looked at my nose and kind of tried to figure out what the problems were based on the symptoms. And he noticed immediately that my turbinates were really big.
The inferior turbinate, it's a normal structure in your nose that everybody has. It has a role of filtering and humidifying the air that you breathe in. So it becomes enlarged and inflamed when it is irritated by either allergies, infection, or pollution in the air. Considering her busy schedule, we decide upon a two-pronged approach treatment. Balloon sinuplasty in office to treat her sinus issue, and inferior turbinate reduction to relieve her nasal obstruction.
I don't really have any more sinus issues. I haven't had a sinus infection since the surgery, and it's been a few months now.
The advantage of balloon sinuplasty is that it can be done in office. There is no general anesthesia. The cost is less than doing it in the hospital, and the recovery time is really quick. There's really no downtime. The patient can go back to their daily activities quickly.
It's actually kind of funny. There's a lot of things that I didn't realize were issues until after the surgery. I know one time I was sitting in my bathroom and I was sitting there and there was a candle about 2 feet away from me, and I actually could smell it. And that was something that I have never done before, and it kind of just hit me. I was like, I can actually smell the candle.
Welcome. Today we're here with Dr. David Fish, who's the Director of Interventional Cardiology at the Texas Heart Institute. Dr. Fish, thank you so much for joining us today.
It's my pleasure.
So we know that you have done so many wonderful things in your career. Today we have just a few minutes to talk about one of your great interests is transcatheter aortic valve replacement. Could you tell the audience what is that?
Well, for many patients, especially those reaching older age, often the aortic valve, which is the main outlet valve for the pumping chamber of the heart, becomes narrowed or stenotic because of degenerative changes of the valve. Ordinarily, this is a reason to do open heart surgery to surgically replace the valve. But in some cases, the risk for open heart surgery is very high for some patients. So for selected patients who have this problem and who are at high risk for surgical valve replacement, now we have techniques available and instruments available by which we can deliver a valve into the valve position through a catheter.
Wow, that sounds very amazing. For years, there was only surgical option for these patients. Is this happening in multiple centers?
Yes, they're widespread now in the United States. There is, as yet, only a single commercial valve available, and the delivery systems are large and require a lot of expertise and a great deal of teamwork in order to deliver successfully.
We know that the great thing about the Texas Heart Institute is that it's a huge team of cardiologists and surgeons and support services. So we know that you are one of the great teachers here at Texas Heart Institute. Tell me what you feel about educating these students over the years. What has been your main feeling about this?
Well, we're fortunate here to have had over the years very highly qualified, very gifted students of medicine and doctors who come for their postgraduate training in cardiology here. And among these, a number selected choose to go into interventional cardiology. That is, of course, the branch of cardiology involved with putting instruments in the body and opening arteries and correcting structural defects in the heart. It's been my great privilege to have trained a great many of the operators who have gone out from the Texas Heart Institute into the community and to other places in the country and have brought forth the skills they've learned over there.
I know that you have been my favorite teacher in all of my career, and I thank you in front of the world for being such a fabulous teacher about cardiology and about life.
You're very kind.
Thank you. We just have a few more moments. What would you like to tell the public about the Texas Heart Institute and perhaps getting their evaluations done here?
Well, the Texas Heart Institute has a long tradition of research, patient care, and of course teaching. And in this kind of environment, I think patients get the best possible care and the most astute kind of understanding of their problems and their specific needs. In addition, of course, with the critical mass achieved here with all of the different researchers and the different clinical efforts and the different programs, every patient has a chance to get the very best of what cardiology has to offer.
Well, we thank you so much. You've been such a tremendous force here in the Texas Heart Institute and in my life, and I want to thank you.
Thank you.
On a day-to-day basis, I was experiencing chronic pain, chronic migraine all day, 24/7. I'd wake up with one, I'd go to bed with one, and it would never go away. I tried everything from acupuncture, a chiropractor, nerve blocks, spinal tap, and there was no relief with anything.
When Jennifer first came in, she was 17 years old, had been totally debilitated by her headaches, had been basically housebound, was homeschooled, hadn't been able to do all the normal stuff teenage girls do during high school, just because of her chronic daily pain. And so we talked, decided she was a good candidate for the trial, and then when we did the trial, when she came back several days later, she'd been almost essentially pain-free from the time we put the trial in to when she came in to take the trial out.
The 5 years I experienced chronic daily migraines, I was completely limited. I couldn't do anything, stuck at home, dark bedroom, cold room, the typical, I've got a migraine, don't talk to me, irritability, everything.
We've been using stimulators for chronic back pain for 30 years or so, and Dr. Reed decided one day to somebody with headaches to try putting a stimulator over the peripheral nerves that supply around that scalp. And the patient had really good relief, and that's how it all kind of got started. Now to have a procedure that gives people either complete relief or 80–90% relief, that was real dramatic, and that was, you know, just the stories you get back from patients was what makes it worthwhile.
I can do anything. I feel like I can experience anything. My pain isn't holding me back. I'm, you know, going to school, experiencing life to the fullest as where I wasn't before. The neurostimulator completely gave me my life back. My life has completely changed. I've done a 180, and I feel that I can experience anything because I'm pain-free.
So many of us have problems with our feet. We stand on them all day long, they hurt. We're complaining of painful feet and legs. Dr. Gabriel Maislos has answers for us with regard to foot problems. He's a podiatrist here in the Houston area, and he has a special story for us today. Let's watch and see how this can benefit us.
I came for the treatment for my toenails most of all, but all my all my toenails were bad, really bad. They were in bad shape and they were discolorated, like some white stuff on them. How to say? They were disattached from the nail bed in one place especially, and was kind of yellowish too.
Ms. Ina Yashova came to my office complaining of fungal toenails. Very common thing, especially, you know, you see it in summertime, it's very prevalent. It's a fungal infection of the nails are discolored, and she wanted them treated. I keep my body in shape, and I want to be healthy, and I want to have, you know, everything perfect. So it's one of the things when I found out that something is wrong, I couldn't go for some time because I was busy, but I told to myself, no, I have to. It's basically a YAG laser, and it creates this intense heat, and it kills fungus, bacteria, virus, and it kills it at the root of the nail. That's where the nail begins. From that point on, we have a protocol in place to prevent reoccurrence, because probably most of the problems that have occurred in the past is even prior to the laser with the oral medication was that you would get rid of the fungal infection and then it would come back. So you also have to do your part to make sure that you don't get a recurrence, because once you're susceptible to fungal infection, you remain susceptible the rest of your life. I figured out that I have good results because when I could see there my nail growing, the new nail will come pretty and doesn't have anything, like no fungus, nothing, no discoloration. It was pretty and nice and healthy nail. The risk of a fungal infection is not just, you know, the appearance, and so you don't want to wait on it. You want to make sure you come in early because you don't want to go to that severe category where you might require multiple treatments. It's better to treat it early on. Not only that, the nails, when they become fungal, they become yellow, thickened, discolored, hypertrophic, and you can develop ingrown toenails. That's a serious risk because, you know, that's an infection, and that requires a surgical procedure. I got new nail bed, new nail, and it was like pretty healthy.
There are three kinds of skin cancer. There's squamous cell carcinoma. That's the kind that occurs in scaly lesions that grow in size, usually in the sun-exposed areas. There's basal cell carcinoma. Those are gray and pearly with sort of heaped up raised borders, usually again in sun-exposed areas. The most important and most dangerous skin cancer is melanoma. That's what occurs in moles. We use the ABCD rule to decide if a mole or skin lesion looks like it's bad. A for asymmetry. If the lesion doesn't look perfectly symmetric, then that's a bad sign. B for border. An irregular border is a bad sign. A regular border is a good sign. C is for color. If a uniform color occurs in a mole, that's good. If there's multiple colors or irregular colors or a change in the color, that's a bad sign. Diameter. 6 millimeters is the magic number. Anything bigger than 6 millimeters is bad, and that's about the size of an eraser. So take good care of your skin. You only have one layer.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab.
For more information on any of the doctors you have seen on today's show, go to our website, bestdocsnetwork.com. Now it's time to head to our next doctor, Dr. Stephen Rose. Dr. Rose has been a radiologist here in the Houston area for many years. He has a special interest in the early detection of breast cancer. Watch this segment as we see how Dr. Stephen Rose has helped many women in the Houston area with regard to evaluating and treating breast cancer.
After having met with Dr. Rose, toured the facility and saw the importance of the work on the early detection side, I was compelled to do something more. It's kind of like once you have knowledge to do something, then you have to move forward and make sure that others know about it as well.
There are several things that we're looking for the foundation to do. One is to continue to fund important research. There's always going to be more things that we can learn and do better. The number two thing is to be able to educate both other physicians and the community, especially the community, so that people begin to understand and participate in the process of screening. Because the sad thing is, in recent years, screening mammography, especially in younger women, has decreased. And now I see women show up who haven't had their mammogram and they have more advanced tumors. I hate seeing that. We also want to try to be able to raise enough money to do more indigent care as well for those who need additional care. So those are the three main areas we're targeting.
What I love most is the fact that we're educating other radiologists to read these mammograms so that we can spread the word quickly, and also the amount of anxiety that the results of these tests provide.
Very few people really realize that almost all of the breast cancers are detected in the community. They're not detected at facilities like MD Anderson for the most part, because most people are referred with the diagnosis there. So the research foundation was based on that idea that we could fund research in the community and do things that weren't being done elsewhere.
Our work is so important. I feel that we can take a big bite out of breast cancer incidences if we can move forward with this early detection. Women who are vigilant about having their mammograms annually using a 3D tomosynthesis procedure can certainly help themselves. And not just for women who are insured, but we would like for every woman to have this available to them.
For additional health information, be sure to check out our Healthy Living blog for the best tips, latest medical procedures, and up-to-date news for modern medicine at our website at bestdocsnetwork.com.
Coronary artery stenting is a part of interventional cardiology that I absolutely love. It's been around for about 30 years now. Initially, the great giants of cardiology formed a cardiac stent, which is just a metal mesh that we place on a balloon catheter, place it into the coronary artery that's obstructed, open it up, leave the stent, and remove the balloon and the catheter. Easy procedure, but years ago it was quite difficult, and catheters were larger, there were a lot of bleeding problems, but now the catheters are quite small. The procedure is fast, done quickly and without much discomfort at all for the patient. If a patient presents with coronary artery blockage, they can go to the cardiac catheterization laboratory, have the coronary angiogram procedure done, and then if there's a blockage, we can place a stent right at the same time. Coronary stenting has protected many patients from going to cardiovascular surgery, has improved lifestyle, and many patients have gone without symptoms for many years because of coronary stenting. We thank the developers of coronary stenting, and we look forward to a future of great developments with regard to the coronary stent. This is such a fabulous event. It's called Go Red for Women, and it's putting together women from the community, physicians, hospitals, everybody supporting women and heart disease and the awareness for women to protect and support. Even children can benefit from this event. So I think it's so fabulous, and that's why I wanted Best Docs Network to really talk about it.
My speech today is going to be about how I'm dealing with heart disease and how to have an optimistic and positive attitude while going through something or anything difficult in your life. I keep laughing, I keep smiling, try to stay positive about things. I could be stuck in the hospital, but instead I'm home with my family.
The biggest way to prevent these problems is education. So the main reason for this type of event is to educate, and through that we raise funds and can get the word out.
Number one, it educates people on what has happened over the last several years, and it brings to the forefront, with women in particular, with Go Red for Women, to listen to your body and know your symptoms.
The most important thing about cardiovascular disease is the #1 killer of women in this country. And 50% of women or men with cardiovascular disease die suddenly, without any symptoms, without any warning.
I just believe getting the word out to women especially. We always are tired and run down and raising kids and going here and there, and we might just think, oh, we're just tired, my neck hurts for some reason, and it's no big deal, but it could be a sign of a heart attack or a stroke.
And women, you know, are just, and they're, as we know as men, are different. And they present differently. Fortunately, stroke-type symptoms are about the same, but again, another large focus for us is heart disease, and they are completely different in the way they present as a general rule than men.
Cardiovascular disease and the awareness for women is such a tremendous topic, and that's why Go Red for Women is such a marvelous cause, and I just want everybody to support it.
What the side effects, and it gave me an opportunity to just weigh the pros and cons of whether I wanted to go forward.
The treatment is to close all the veins that are running backwards. Any vein that is not pumping up out of the leg is only hurting, it doesn't help, and so by removing or closing those veins, you restore the circulation out of the legs back to normal.
The procedure itself probably took 30 to 45 minutes. I was able to get up off the procedure table right afterwards and walk. I did have improvement in cosmetically, which is a wonderful side benefit, but I also have decreased swelling, decreased aching. Really, it's very minimal.
She got a great result. Her swelling has gone away completely, her pain has gone away completely, and her varicose veins have gone away completely as well.
I decided to come see Dr. Marvin because I struggled with weight my entire life.
Well, Amanda's a fairly young patient. She was in her mid-20s when she had the surgery. She did meet the National Institute of Health criteria for weight loss, which means that her body mass index was 41. She was morbidly obese. She wasn't manifesting too many other medical problems related to her weight yet, but again, she's on the young side, so she had some lower extremity swelling and those kind of things. There's tip-offs that things aren't quite right.
I was very uncomfortable. I was like one of the only heavy people in my group of friends. My husband is very lean and active, so it had a lot to do with our lifestyle. And I wasn't able to go to the pool, and I didn't want to wear sleeveless shirts, or when my friends went out to the club, I didn't want to go to the club. And so it had a lot to do with my age, and I wasn't able to live life.
Amanda's lost from 240 pounds down to 128.5 pounds, and that's a very significant weight loss. That's great. That's a very good outcome for a gastric sleeve.
The recovery for me was pretty simple. I took 2 weeks off of work. I could have gone back within 5 to 7 days. I get emotional when it changed my life. Just wearing sleeveless shirts, being able to dress like everybody else, being able to spend time with my husband and go to the pool and just be active. A lot of people started to talk to me again because I wasn't friendly whenever I was heavier. I was angry, I didn't want to do anything, I was like a hermit. So my responses, I mean, they want to know how I did it, and I'm very open about how I did it. I was like, you know, I had the surgery. I couldn't do it myself. I could not do it without the surgery. Could not have done it.
My patients, since obesity is a systemic disease, when we cure it for them, they get better on so many fronts. It's nice to see how they're doing afterwards. They really are changed people.
The need for vaginal rejuvenation isn't always talked about, but it is a common problem. Dr. Imtiaz explains why.
For a lot of women, once they've had children, they feel that sex is not the same as it used to be. They don't have control during intercourse, they don't find pleasure during intercourse, and in general, most patients would say that they feel loose. If a woman feels loose, then she has the option of having a vaginal rejuvenation done. And it's a procedure where I would reconstruct the pelvic floor muscles and also tighten the vagina in order to give her better sensation during intercourse.
Appearance can also be a cause for surgical intervention.
If a woman is concerned about aesthetically the way she looks, that surgery can also be done. As a vulva ages, you may notice wrinkling or loose skin on the outside, or some women, even as young women, notice that the shape of the external genitalia is not pleasing.
But age doesn't necessarily determine the need for vaginal rejuvenation, as young women are sometimes candidates as well.
It's not uncommon for me to see a patient who's young, maybe even in her late teens, who has labia minora that are so elongated that she's embarrassed to wear a bathing suit. And it changes their life when you can improve the appearance and give the woman a confidence that she may be needing.
Thanks to Dr. Imtiaz and her vaginal rejuvenation procedure, her patients are living a fuller, more confident life.
But vaginal rejuvenation in its true sense, it's more for tightness and function, but we can also change the way you look.
Well, we hope this edition of the Best Docs Network has helped you to learn more about disease affecting many organs in the body and how we can prevent, evaluate, and treat these diseases. We've featured some of the best physicians in the Houston area that have helped change people's lives. For more information, for any of the fine doctors that you've seen on today's show, head to our website at bestdocsnetwork.com. If you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com. See you next time.